Now, did our one people want to say anything else, or?
That would be great.
You do? Okay, we'll get you a microphone. By the way, did you want to say anything else?
First off, Senator, thank you very much for your support of the One campaign. We really appreciate it. You're invaluable to the campaign and have been a great supporter throughout the campaign trail. The One campaign is a bipartisan organization working to raise awareness about the issues of extreme poverty and preventable diseases. What we're trying to do is build political will behind these issues to help make progress on them. Currently, 30,000 children die every single day from preventable diseases like tuberculosis and malaria. 1 billion people don't have access to clean drinking water. These are issues that America is really starting to take leadership on, and the global community is stronger because of it. And one is proud to have Senator John McCain as one of our supporters. And you know, one of the issues, or one of the reasons that the United States has become a world leader is because of the President's Emergency AIDS Plan in a bill called PEPFAR. The question we have today for you, Senator, is do you support the reauthorization of this bill?
I do, but could I just, before you leave the microphone, you might mention very quickly that there are thousands of members of One who actually, at their own expense, travel to Africa and go to these villages and go to these places where people are impoverished, where they don't have clean water, where malaria is. You might mention that, because I think that is a dimension that a lot of Americans don't know about. And then I'll stop. Go ahead.
Yeah, absolutely. And really what the campaign is all about is using your voice to make a difference. We don't ask for any donations from our members. We're all about building political will and making sure that our representatives and senators know about bills and legislation that's important to our cause. And a lot of our members, it really does show the greatest compassion of America. The organization is all about that, and building ties across the aisles to make sure that those goals are achieved.
My answer to your question is yes.
Thank you, Senator. When I was a student at Army War College in '93, I did a back-of-the-envelope analysis on Medicare, Medicaid, and the FEHBP. And what it showed me was what tremendous waste there is in our spending, because potentially we could have saved about $956 billion in outlays in a 4-year period. 2 years later, Senators Danforth and Senator Kerry published a bipartisan report stating that discretionary spending would be completely exhausted by 2020 if we didn't do something about deficit spending. 2 questions. One is, why is it that Hillary Clinton is viewed as the persona that she is in healthcare restructuring when it was handed to her on a silver platter, and frankly she blew it? And then second, what are you going to do to kick Congress in the butt and have them thank you for doing it to address this budget issue that we're facing?
Thank you. Thanks for serving. Just to add a little bit to the persuasion of your argument, a couple of days ago, the Secretary of Health and Human Services, former Governor of Utah, Mike Leavitt, gave a speech which, in the starkest terms, he described the serious problems that the Medicare system is in. I mean, he just flat out says it's going to go broke, and gives numbers and statistics that have come from the Medicare trustees on the issue. All I can say is that, yes, in 1993, we rejected the then Clinton universal health care proposal. It was rejected by the American people. I don't like to use this term, but the latest proposal I see is putting lipstick on a pig, as we used to say. So, but I do want to mention one point in addition. I was at the Cleveland Clinic yesterday. Cleveland Clinic is one of the premier healthcare institutions in America. And they and other institutions I visited, like the Lehigh Valley Hospital, they are making incredible use of technology. They are making incredible use. And there's technology that is startling. I saw with a heart surgeon a robotic device that performed heart operations that goes in between the ribs. Remember, they used to have to open the chest. It goes in between the ribs. He's sitting with a, by the way, this technology was developed by the military. And he's sitting there with running these little arms. And I met a woman who just a few days earlier, a handful of days earlier, had had a heart operation to fix a faulty valve in her heart. Now look at that technology as opposed to, look at how much cost savings that is for the length of her stay, the length of the operation, that all of those things. And also, there's now capability for monitoring patients that is incredible. And instead of having stacks of paper, has anybody, I'm sure that maybe those who are a little older, you've seen your health records? You know, are they this high? Are they this high? Are they this high? And the X-rays that the doctor has to slap up on the, up against the light. Now all of that is technology that's online, where the doctor can call up. One of the doctors that I talked to, he had a patient, and the patient was on vacation, and the doctor was on vacation, but he was looking at his overall healthcare record, and he saw where that patient might have a problem that had to have additional tests. Now, he called the patient. The patient came back from vacation and got the needed tests that he needed. This is all because we can share technology. And finally, one of the aspects of this issue that's important, because there's so many aspects, it's a complicated system, is a thing called medical errors. You know, Americans probably know least about this problem of, quote, medical errors, and how many lives are lost, and how many people's cases are complicated because the nurse couldn't read the doctor's handwriting, or there was a misapplication of something that was prescribed, or it simply was overlooked. I mean, medical errors. Well, with this new technology and this online and sharing of information, medical errors have plummeted. Therefore, guess what? Saving, first of all, the most important thing, quality of healthcare is going up, but the cost savings have been phenomenal. So I agree with you that we've got to make fundamental change, but I also agree with some of these people who are with sharing online technology today. The technology of being able to share and monitor and do the things we're doing is remarkable. We got to make it more widespread, and we have to make patients aware of it. And by the way, give patients more choices in what kind of care they want and where they get it. Yes, sir. And thank you for serving. Yes, sir. By the way, I'll be glad to discuss any other issue that's on your mind as well. Please go ahead.
Thank you, Senator, and I appreciate all the years of being a pork buster, so I just want to thank you for that. If you have any considered legislation, since you were a big proponent against the anti-smoking, that we control tobacco, that we also, the FDA can control tobacco, we get away from the 7-Elevens and so forth, that we stop lawsuits, we stop any possible tax cuts for tobacco farmers, we stop exporting remarkable products across the globe. I mean, we're talking over years, get tobacco farmers in the system through, but maybe stop smoking, stop trying to tax it out. Just say it's a bad product for America. Thank you.
Yes, sir. And the thing I was puzzled by was when we decided we would want to fund the Children's Health Insurance, S-CHIP program, with guess what? Taxes from the sale of tobacco products. Now somebody's going to help me out here. So we want to fund a program to give children health insurance, but we want to fund it by encouraging people to use tobacco that kills you. Only in Washington. Only in Washington could we come up with that kind of a scheme. I just want to mention one other thing about tobacco, and maybe expand just a bit.